Hello and welcome to the Behavioral Health Matters podcast with Magellan Behavioral Health of Pennsylvania. This is the show that aims to promote positive mental health, increase our understanding of behavioral health topics and services, and reduce stigma. I'm your host, John Lees, and I'm the member and family advocate at Magellan of Pennsylvania here in the Lehigh Valley. On this episode, we'll be discussing supports and services for people with intellectual and developmental disabilities with our special guest, Jessica McKenty-Nuttall. Jessica is the Director of Advocacy at the ARC of Lehigh and Northampton Counties. The ARC of Lehigh and Northampton Counties is an organization that envisions that all people with intellectual and developmental disabilities are valued, respected, and fully included members of their community, with the right to choose where they live, learn, work, and play. During our conversation, Jessica helps us to explore the complex world of intellectual and developmental disabilities, or IDD, as we delve into the supports offered by the ARC, in addition to the specific mental health concerns that commonly affect individuals with IDD. Join us as we break down the stigma surrounding mental health in the IDD community and seek to gain a greater understanding of the challenges they face, the supports that exist through the work of agencies like the ARC, and how we can learn more and get involved. And stay tuned at the end of this episode to learn how you can provide us with your feedback about the podcast and make suggestions for future episodes. And now, here's my conversation with Jessica McKenty-Nuttall. Hey there, Jessica. Welcome. Thanks so much for joining us in this episode. Let's start with your background. Can you share with our listeners a little bit about yourself, including your current role at the ARC of Lehigh Northampton Counties?
Sure, absolutely, John. First, let me thank you for reaching out to the ARC and extending the invitation for me to join your podcast.
Absolutely.
The intersectionality of those with intellectual developmental disabilities, which I will frequently refer to as IDD today, and those with behavioral health needs is very real and becoming increasingly common. I'm looking forward to diving into that a little bit more today. But a little bit about me. So my interest in the IDD field actually sparked in middle school. Where I went to school, students with disabilities were segregated into their own classrooms in the middle of the school, at least from my recollection. They came to recess and to lunch, but we didn't really interact much with them, mostly because at this point, stigma is alive and well, and there's no education on the understanding of disability and no true efforts of inclusion at that time. And I didn't feel that this was right, even though I'm only a middle schooler. So I spent all of my free time in lunch and recess with my peers because that's how I viewed them, as my peers. They just happen to have disabilities. I'm also a family member of a person with a disability and witnessed firsthand growing up the destructive havoc that our chaotic special education system can wreak on a family, and just how hard it is to navigate when you aren't taught your rights in special education. So fast forward to college, I was a pre-med major and began volunteering with an organization called Best Buddies that I eventually went on to work for 2 years, which kicked off my professional career in the field. I now have 2 graduate certificates in nonprofit philanthropy and nonprofit governance, and I am working on completing my master's of public administration. I currently serve, though, as the Director of Advocacy for the ARC of Lehigh and Northampton Counties, where I am fortunate enough to live out my passions, advancing the education and rights for students with disabilities and their families, and get to make an impact here in the Valley. I have been in this role for 6 years, advocating alongside my team for a free and appropriate education for students with disabilities. Our department is staffed by myself, 2 full-time advocates, and our newest addition of a bilingual intake specialist. Together, we serve hundreds of families each year in Lehigh and Northampton counties and our surrounding areas via our resource coordination and one-to-one advocacy initiatives.
Wow, that's awesome. Such a great, rich history that you have, a lot of experience, and I'm really excited to get into this topic. Really kind of understand what the ARC does, kind of your role and where you're situated within the organization. and being able to kind of talk through some of that. So let's start with some of the basic information about intellectual and developmental disabilities. Could you help the listeners understand just a little bit more about some of the challenges facing people with intellectual and developmental disabilities?
Sure, absolutely. So the first thing that's really important to note is that intellectual and developmental disabilities are not one and the same. By definition, an intellectual disability is one where a person's cognitive ability and skill sets are impaired. Typically, their cognitive ability falls at or below 70 IQ points. So an intellectual disability is a type of developmental disability. And developmental disabilities are the broader category of disability, and defined by the CDC as a group of impairments that can affect a person's physical, learning, language, and or behavioral aspects. These conditions are usually present at or before birth, but may happen in childhood and usually last through a person's lifetime. So examples of developmental disabilities can include autism spectrum disorder, cerebral palsy, fetal alcohol syndrome, ADHD, and many others. So kind of think of it as developmental disabilities as this big umbrella, and most disabilities, including intellectual, fall underneath that. The CDC currently reports that 1 in 6 people live with a developmental disability. But in terms of challenges faced, unfortunately, this conversation has no limits. From Social Security asset limitations to marriage equality to accessibility to special education and everything in between, individuals with disabilities are constantly needing to prove their belonging in an able-bodied society.
Wow. Okay. So much there in terms of, helping to give that kind of understanding of what it means to try to navigate, I'm sure, one's life and everything that comes with that. So I'm struck by that, thinking of just education and kind of, you talked about your experience at the outset when you were a student yourself. And I'm sure as folks are transitioning into adulthood and young adulthood and the challenges that anyone would face, let alone someone with an intellectual and developmental disability. So very helpful to give us that kind of background and understanding of the impact. So based on, and you kind of touched on this a little bit, but in your experience, and we think about, intellectual and developmental disabilities and mental health, what would be an effective way or some effective ways to think about assessing mental health as it relates to intellectual and developmental disabilities? In other words, how can caregivers or providers or other folks involved kind of be helped to or trained to look for and recognize signs that might otherwise be overlooked? Yeah.
That's a great question. And while I do have an undergraduate degree in medicine, I'm not a medical provider. And I do study a lot of special education law, but I'm also not a special education attorney. So I'm going to hit this broadly in saying that the most effective avenue to advocacy is vetted information. So at our ARCS advocacy department, we run on 4 pillars: collaboration, education, empowerment, and self-advocacy. Education is really that tool that individuals can use to not only better themselves in understanding the systems, the symptoms that go along with IDD and behavioral health and the intersectionality between the two, but also in educating others. So I think my biggest piece of advice when you're working with someone who might be in that dual diagnosis category, so for our audience, that could be someone who has an intellectual or developmental disability and co-occurringly has a behavioral health condition. And commonly those do come together, and we've kind of termed that dual diagnosis. We're marrying both of those worlds. I think it's really understanding the background to each of them, and that might just come with understanding what developmental disability was, as I previously talked about, how that kind of trickles down into some other common disabilities that we may know of, and then what you're seeing on the behavioral health side of it and how that can manifest, and then how do those intersect. And I'll give the example of ADHD. So ADHD stands for attention deficit hyperactivity disorder. You can have an inattentive or an attentive type. So sometimes that may come off as saying just ADD. We don't have that H component to it, right? When you're looking at the overall picture of ADHD, there are a lot of factors that come with that. There is the inability to have attention, to stay focused for a long period of time, easily distractible. But there's also some components that work for some people with ADHD and don't work for some people without ADHD. For the example, some people may find that they can focus easier if they have background noise on, having TV or having music. For some people, that also doesn't work. But there's other components that come along with ADHD because it is a disorder of your frontal lobe. And that can come through an emotional dysregulation. And it's a spectrum itself. Some people with ADHD may show these types of characteristics and some don't. So I think the most important component to advocacy is really understanding what you're looking at, taking the time and doing the research in, so that you can provide the best care, advocacy, education for the individual that you're working with.
Gotcha. So there's, would it be fair to say it's very individual or could be very individualized?
Absolutely.
Yeah. Okay. So
yeah,
that's helpful. Okay.
And that's the approach we take in our advocacy department as well. And that's honestly the approach in special education. And IEP stands for an individualized education program. And I think that's really what we have to focus on when we're looking at each person.
Right. So what regardless of diagnosis, what might work for one young person may not work for someone else because of Gotcha.
Yeah. And inversely, there's also these opportunities that may work for the majority of individuals with and without disabilities. And in education, we call that universal design of learning. Just because you may not have that categorization of a disability doesn't mean that you also don't benefit from a visual schedule. Everyone learns different. So it's really just taking that unique approach and really tailoring what you're doing or looking for in advocacy and putting the research and education behind it so you understand the full picture.
That makes total sense.
And now, a brief word from Magellan. If you are a loved one or a Magellan of Pennsylvania member and have any questions about services, please visit www.magellanofpa.com for more information. And now, back to the show.
Well, let's reverse a little bit or back up a little bit. Let's actually talk about the ARC as an organization. So we kind of touched on this a little bit through you describing the role that you have there now and have for a while. But let's start with some of the basics for our audience. Can you share a little bit about the history of the ARC? And then also, too, I'm sure you do this anyway, but just kind of the overall mission of the ARC.
Yeah, absolutely. So the ARC of Lehigh Northampton counties specifically, that is where I work as the Director of Advocacy. And our ARC chapter was founded in 1967 by Park and Helen Sperry and a group of concerned local families who sought new opportunities for their children to lead fulfilling, engaged, inclusive lives as active members of our communities. At that time in 1967, little was known about people with IDD, and there was virtually no support or programs to serve people with disabilities and their families in their home communities. So like every parent, our founding families wanted more for their children, and instead of shuttering them into institutions, which were very much alive and well at that time and still are in America here, even in Pennsylvania, and that was the standard recommendation, was to put an individual with a disability into an institution. The Sperrys and the ARC's founding families were determined to advocate for their children and help them achieve their life's goals as fully included members of their communities. So then what began as a handful of families coming together to support their children and others in our Lehigh Valley communities quickly evolved into something much bigger, more powerful movement. And these families really focused on helping their children continue to learn and grow, began gathering in church basements to serve support groups for their loved ones and to continue to figure out how we can promote their development and well-being of their children. And so in that spirit, the ARC of Lehigh Northampton counties was born. So there is a rich history both to us and the ARC of the United States. So I think it's important to note that the ARC of Lehigh Northampton counties does not stand alone as its own entity.
Gotcha.
While we are our own 501c3 nonprofit organization, we are a part of a network of ARC chapters across the nation. So the ARC of the U.S. stands as our parent chapter. Every state in the U.S. has a state head chapter. So for us, it's the ARC of Pennsylvania in Harrisburg. And then different sub-chapters come from that serve local areas. There are about 600 plus chapters across America. And each one of them does operate as their own 501c3, but what brings us all together is advocacy. So every single one of us participates in advocacy at some level. That may not always be how necessarily our chapter does it, but we all, we are an advocacy agency nationwide for those with IDD.
It's interesting. So 600
Yeah.
across the entire country. And,
Yeah.
and so there's some, I'm sure, some common functions and mission, right?
Yeah.
But then you have the ability to be autonomous somewhat locally to meet the needs of your community here,
Absolutely.
for example.
Yeah.
Okay.
Yeah.
So it's kind of the best of both worlds. You've got some ability to be flexible and really meet individualized needs here in Lehigh and Northampton County, but you've got the backing of a large organization, that's helping to, I'm assuming, provide resourcing and
Yeah, absolutely.
best practices, things
Yeah.
like that.
Yeah.
That's awesome. What would you say, and you can answer this either way, whether you want to think local or larger or both, but what do you think would, if you had to say what the biggest or most significant impact of the ARC within just overall, but also maybe within human service
Yeah.
sector? So, I think of human service, we think of education, healthcare, vocation. There's so many
Right.
elements that go into that or systems that go into that. But in terms of the ARC and the impact, what would you say is the biggest impact?
Yeah, I would say I can answer both. So in terms of the biggest impact, the ARC network is the biggest advocacy network that exists for people with IDD in the country. So you can visit the ARC of the United States website and see their mission and how they work on a more federal level to address the needs of those with IDD and the services that they offer. And then locally, we have very unique programs here at the ARC of Lehigh and Northampton counties that really fit very specific needs and niches within our community. And I think that itself is our biggest impact. We do advocacy very uniquely to serve Lehigh and Northampton counties, and we do it on an individualized basis, serving those honestly across the lifespan with a heavy focus on early intervention and K through 12 education. And that is something that is very unique to our community. We also provide our service completely free. So within our one-to-one advocacy and our resource coordination initiatives, we don't charge for them. And I think that offers a power to our community in terms of a resource that you can, as I mentioned earlier, become educated and learn more about the system that you're working in or that you have to work in. If you're a parent who has a child with a disability, you don't get a handbook when your child gets that medical diagnosis, and that medical world doesn't always translate to that education world. And trying to tie the two is really confusing to people who are not taught the difference between the medical system and the education system and the nuances that come with special education. And that's what we're here to do. We do provide that in our advocacy department, all the way from, I don't even know where to start with this intake. I just have an issue, all the way through case resolution, where we bring you and your family to a collaborative place with the team that you're working with.
So that's really wonderful. So and now you oversee the advocacy department, right?
Correct. Yeah.
Okay. So just thinking about that in particular, and you kind of touched on this a little bit with your last answer, but what are some of the current, so thinking of right now, current advocacy and support priorities for the ARC? And then if you can also touch on how you work with the other system stakeholders, whether it be maybe providers, school districts, I'm thinking of all kinds of other potential folks within the systems to help advance these priorities and these goals.
Yeah. So the ARC's advocacy department, the ARC of Lehigh Northampton, our advocacy department, as I mentioned before, has two main programs. So we do resource coordination and one-to-one advocacy. And our resource coordination is our biggest growing program. And really what that is let's say you're moving into the Valley, or you've lived in the Lehigh Valley, and you just recently had a child with a disability, or became a caregiver for your sibling or your parent, or got guardianship of or power of attorney. Like, there's a lot of ways that disability can enter your life, or maybe it's with you yourself. And there's a lot that goes into navigating the early intervention, the education, the adult system. So our resource coordination initiatives really sit to be making the Arcs Advocacy Department the resource hub in the Lehigh Valley for those with intellectual and developmental disabilities. So any question that you may have related to those, if we cannot provide you with the answer directly, we will tie you to a person who can provide that answer. And I think that kind of speaks here to the connection that the ARC and Magellan has. So the ARC, our mission is focused on those with intellectual and developmental disabilities, but as we've referenced, dual diagnosis, that intersectionality of disability and behavioral health is becoming more and more prevalent. So individuals who have needs in both arenas, and that may not always be the best served by us. At the ARC, we can really navigate that IDD component for you, the supports and services that go into that. But Magellan has that expertise in behavioral health. And so if there's a component there that's really specific to those needs, those resources, those connections that I don't have or my staff don't have, we will refer out. And we'll do that for other arenas too. We aren't ones who work directly on situations that involve Social Security, but I can get you in contact with specific people at the Social Security office who could help navigate those specific things. So it's really kind of working through, I have this question, I don't know where to start, or I just need a resource on this. Our resource coordination efforts can really help bridge that gap and give you an immediate answer. And then our one-to-one is really focused on those complexities that we experience primarily in the early intervention and K-12 education systems. For some people, learning their rights, learning the way the system operates and how to navigate it is enough. And for some people, it's not. For some people, we really need to give that one-on-one attention to make sure that student is getting a free and appropriate education in their least restrictive environment. And that's what our two full-time advocates really work towards. So I think, those two programs together have really kind of created this niche in the Valley where we're able to serve across the lifespan in IDD and connect you to where you need to be to get educated and create the most community-focused life for the person you're assisting.
That's really interesting. And I know we've had overlap in my role as the member and family advocate at Magellan. I know I've made referrals or had communications with the advocates at the ARC, and it's been very beneficial and helpful to those cases to be able to make that connection. So it sounds like a lot of that work that you're doing is to first triage what is the need, that the individual is presenting with, right? And then kind of lay out a plan of how do we get them to the outcome that makes the most sense and has the maximum impact. So whether that's a referral to the right resource related to education or what have you, it's a very similar goal. So and I think when we think about the Lehigh Valley in particular and the different providers and agencies that are out serving individuals across the lifespan, that is one of the things that I think we're constantly needing to kind of stay tuned into who's out there, what are they able to do. So I think for me, my own experience, just speaking from my own experience, I think it's been not only the ability to connect people with the right resource to help them with their current need, but also an educational aspect for me that I learned, okay, this is the right resource, or, they've helped me to understand, well, this other agency would actually be a better fit given this situation. So it could be very individualized, but it seems like it's both making those connections, providing that support, but also educating folks along the way. So they ideally, I think people want to be independent. Whether you're a parent, you have a child, they want to be able to independently understand what's best for their child, or if you're an adult, what my needs are, what my wants are, and how to independently access those to have the best quality of life.
And now, a brief word about 988. Are you or a loved one feeling overwhelmed or struggling with your mental health? Well, you are not alone. Call or text 988 for help. Trained counselors are available 24 hours a day, 7 days a week to provide support and resources. Remember, help is just a call or text away, and that number again is 988. And now, back to the show.
And as I referenced earlier, the department, the ARC's advocacy department, really kind of runs on these 4 pillars of collaboration, education, empowerment, and self-advocacy. And if we tie what we both just said together, that collaboration can fall all the way down into that resource coordination. So giving you the direct answer, we do free webinars 1 to 4 times a month, depending on the topic or the needs of the community. Accessing those webinars, being able to educate yourself moves you into that education component of our pillars. And once you feel educated, once you're confident in what you know, regardless of disability topic at all, just in general as personhoods and humans, once we're confident and educated, we feel empowered. We have the ability to go out with confidence and say, no, this isn't right. No, I'm confident in my ability to tell you that I know that this is the direction that we need to go, or this is the avenue that I need to take. And then that leads to self-advocacy. And that is the end goal, because really, I mentioned earlier, our department is 4 people wide.
Yeah.
And the Valley serves Lehigh and Northampton counties. And we are such a diverse, beautiful network of people here in the Valley. But the way that we will change the systems, whether it's in education, whether it's in behavioral health, is by creating advocates out of all of us. If we can really get to that point where we seek that education, that it is vetted, that is true, we feel empowered, we go out and we start making the impact by ourselves, there is strength in numbers, that will change the community, that will change the landscape for those with disabilities and those with behavioral health needs, or one and the same. Mm-hmm. And I think that's really the end goal of our department, is how can we bring this level of advocacy to every single person who contacts us.
Yeah, I mean, I think that's a really important message, that that empowerment piece really helps people then to be able to go out and do whatever they need to do to have the best possible quality of life, whatever that means for them. So very well said. You mentioned earlier that the services are free. What's behind that? Where does that funding come from? And then how does that work as the engine to help drive what you guys do?
Yeah, absolutely. So with respect to the ARC's advocacy department, we are a free service, as I mentioned. So accessing our webinars, being a part of the resource coordination efforts, if, there's a one-to-one case happening with you or your family, all of that service is provided for free. But of course, funding has to come from somewhere. So we are really fueled by our community through grants, through fundraisers, through personable donations, people who really connect with the passion that I was referencing earlier, that really feel the mission of the ARC and the mission of our advocacy department to go out and make that change and make that impact. That's who we rely on to continue to fuel this. And the need is out there. The need is out there. We have, there is not one single day that passes that we don't have an intake call, that we aren't triaging a situation for somebody and putting together personalized guided plans to navigate these complex systems. And our community wants to learn. They really do. And that's the really exciting part for us, because we really have a passion for teaching and educating. So, it really is fueled behind all of that.
And you mentioned training, right? So, and I know I've actually had the opportunity to both attend trainings for the ARC, but also to present.
Yes.
Talk a little bit in Magellan to help do exactly what we're talking about, though. Really to help make those connections, to provide that education and information for folks, to really increase that and expand people's knowledge of what's out there, who's out there doing this work. But can you talk a little bit about the training, a little more specific about the training, and then just any other kind of resources or events that the ARC offers?
Sure. So part of our resource coordination efforts exist in webinars, and we have been providing trainings long before I became the director at the ARC and before I joined the ARC of Lehigh Northampton counties. And they used to be in person. So we would bring out presenters on various topics related to IDD, and we would do in-person trainings. And obviously that had to abruptly stop for us and many others across the nation when the pandemic hit in 2020. And we really jumped on the opportunity to do virtual webinars and provide really unique topics. And that's something that we take a lot of pride in, is providing those really unique topics. And they come from listeners to this podcast, to the community members who join us. We read every single feedback survey. I read it personally. And at the end of it, we ask, what do you want to learn? What else do you need to know about IDD? And I'll find a presenter and bring that out for you. So we've really tailored our webinar series to be exactly what our community wants to continue learning. So we do them 1 to 4 times a month, as I mentioned, really depending on the topic and the availability. We are very focused on early intervention and K through 12 public education in our department. So from about the end of August to the beginning of May, they are very much focused on education. But we also do bring in other topics throughout the year, and we do try to hit more of our adult systems throughout the summer. For example, this month in November, we did a 3-part series with the Social Security Administration to talk about the overview of SSI and SSDI, an entire webinar on all the changes that happened within SSA this year. And then tomorrow we're doing work incentives and the Ticket to Work program for people with disabilities. So really tailoring it to the IDD community, but hitting on topics that matter because IDD intersects with every other component of our society. It's not its own isolated block. So those are all free. They typically happen in the evenings just because lots of people work. And we do record most of them. And they're available on our ARC's YouTube page, which we have kind of sectioned off if you visit our YouTube page into like early intervention, special education, K through 12, financial planning, guardianship, just to kind of help even narrow it down a little bit more for our community.
That's great. And it's great that they're able to be recorded. So if someone can't make it, they're there and they can grab that information when it's convenient for them. And
especially if you're new to understanding any topic that we bring within education, IDD, or even the intersectionality of IDD and behavioral health, if it's your first time hearing it, it's complex. These systems are not easy to navigate. So you might need to listen to it a few times. And that's part of our education pillar.
That's great. It's fantastic. I love the concept of the pillars. It just gives a nice visual in terms of, what helps people to stand up. So focus on those areas. It's really standing up the system. And obviously by doing that, you're helping the individuals within that community. So you mentioned YouTube for some of the trainings, but I was also checking out the website. And I know I've been on there a bunch of times when I'm talking with families. Is there anything on there that you can think of that you'd want to highlight for our listeners?
Yeah. I think if you're interested in learning more about the Arc of Lehigh Northampton counties, visiting our history page, which I kind of gave a little bit of an insight to today, but there's more on there to the history of our chapter and how our programs were developed. You can also read about our mission and our vision. And then even specifically to advocacy, which I'm obviously a little biased towards being the director of advocacy, I do want to highlight the description of the 2 programs that I reviewed today, but specifically our intake form, which can be accessed through both the resource coordination and one-to-one web pages. And that intake form really kind of captures everything that we would ask on a phone call. And we understand that many of our families are busy. And sometimes and often we get those intake forms at midnight when you finally had a chance to sit down and get to this part of your day. And we'll always give you a call back. We always have personal conversations following those, but it's an easy and convenient way for you to just put out there what your concerns are. Let us get that information, digest it, and start the process with you. Our YouTube is also located on there, which I did reference, and I think it's a great resource, as well as a training request. So if this is your first time learning about the ARC, you've never visited or attended one of our trainings, so complete the survey to give that feedback. I offer that opportunity via our website for you to submit in and say, this is a topic I think would be really helpful to the community, and we'll work to make that happen for you.
And now, a brief word about the ARC of Lehigh and Northampton counties. If you are interested in learning more about the ARC of Lehigh and Northampton counties, check out their website at www.arcoflehighnorthampton.org. There you'll find everything you need to know about the organization. Again, the website is www.arcoflehighnorthampton.org. And now, back to the show.
So pivoting and looking a little more kind of towards the future, from your vantage point and specifically what you're doing within advocacy, but also maybe a little more, higher level in terms of the overall system. Can you kind of talk a little bit about some of the challenges that you see?
I think there's a lot at play within the IDD world. Like I mentioned at the beginning of this podcast, there are so many areas where more advocacy is needed within IDD and for people with disabilities, and it can range on a wide variety of topics. I think one that's really important, just given our kind of focus in our ARC's advocacy department on education, is really understanding the funding of our education and the landscape that provides for our community overall. So the Individuals with Disabilities Education Act is a federal law that entitles individuals with disabilities in school, students with disabilities, to a free and appropriate education in their least restrictive environment. When IDEA was enacted, it was intended to provide 40% of funding to states for special education costs. Now, special education is a mandated cost, so we have to provide this service to our students because it is what they are entitled to. They deserve an education that is, appropriate to them and equitable to that of their peers. But IDEA has never fulfilled that promise. So I think it's something to understand. Now, I can only speak specifically for Pennsylvania. IDEA has historically funded about 14% of the funding it was intended to do. And in Pennsylvania, that comes down to our property taxes. So when the federal government does not provide the funding that they had intended to provide to the state then needs to make up that difference in their state budget. And how that usually comes through is through property taxes. And I think a really big understanding to our landscape now in education and where we are specifically in the state of Pennsylvania is by going through property taxes, we have created a ginormous socioeconomic divide. So you have our communities that are more socioeconomically advantaged and have the ability to provide the property taxes to make up for that, and thus their school systems thrive more than some of our communities that don't have those advantages. And that's created this gap in access to education across the Commonwealth. And in February of 2023, it was actually ruled by the Commonwealth Court that our funding system in the state of Pennsylvania is unconstitutional in education because of this gap that we have created, not provided, through the lack of provision of funds kind of top down. And I think that's really important to understand. And that's not something that a lot of people talk about in understanding, well, I don't know why this school system is better than this school system, or how do you define what's better and what's not for a school system? And it really does have a lot of factors into it, and that is a major component of it. And I think understanding that and putting more advocacy to where we can grow to build our school system, specifically in some of those communities that are underserved, so that those students have the same chance at an equitable education that's free and appropriate for them as well. And I think that's just one of those small nuances, and there's many of those in the IDD field, to learning and understanding as ways that we can kind of better support this system.
I mean, I guess it's good that it's acknowledged now. And I guess the effort becomes, as we, look to the future, what do we do to tackle that? And then provide more of that equity.
Yeah.
So I imagine the impact in terms of the work that you do is one of the primary areas of focus, obviously education and making sure everyone's getting the best possible education. Right?
Yeah.
So,
and then those systems are then compounded by some of these other shortages that are happening nationally. You kind of open the question with, we're all struggling with various versions of retention and recruitment of workforce. And special education is in a national crisis. Recruiting, training, keeping special education teachers is becoming a harder task by the day. And we are in a national shortage of special education teachers and paraprofessionals. And that really becomes this very complicated position for families of students with disabilities and school systems who may very much want to continue to provide the service that they know that student is entitled to, but do not have the resources to do such. And a family who's sitting on the other side of the table, frustrated that these services are not being provided. And where do we go from here? How do we get creative? How do we still give that student the education that they're entitled to?
In terms of what others can do to help, as our listeners are hearing this information, we one of the missions of this podcast is to help reduce stigma. And we've kind of touched on a lot of areas that I think would probably open a lot of people's eyes. And it's very helpful to advancing the conversation and helping people to feel more comfortable to have conversations like the one we're having, to really create a new understanding or improved understanding, I guess. What can folks do, or directly through the ARC, what can people do in terms of a call to action to provide support or help if they're interested in doing that?
Yeah. I think it's really important to note that while there are many factors that lead to stigma, a lack of education is a big one. And if it's one thing I hope that listeners take out of this podcast is my passion for becoming educated. When you know more, you can do more. And I think that is the most powerful tool, as I mentioned previously, that any person can have when they're looking to have a call to action. But there's a few local call to actions that we can do. Joining our email list at the ARC of Lehigh and Northampton counties will give you access to all of the different webinars and resource coordination efforts that we do, following us on social media. If you go to our parent chapters, the ARC of Pennsylvania and the ARC of the United States, they also have a take action button on their websites. And they do a little bit more of that federal legislative advocacy. So following kind of where they're at in terms of these are the primary focuses that the ARC of the U.S. has right now, or the ARC of Pennsylvania, and how can I do a call to action within them? I also think if you're experiencing an issue that we have touched on or even glazed over in this podcast, calling the ARC's advocacy department to learn more so we can continue this conversation on education can be a first step. And then I think that second step is going out into your community and taking action in the most appropriate way. Maybe that is becoming educated and becoming a better advocate at your student's IEP meeting. Maybe that is contacting your local representative's office and having a conversation about what you're seeing. We have, had the opportunity to work with many of our legislators across Lehigh and Northampton counties who want to help. And I think, they're really willing to give that listening ear. A lot of disability advocacy is rooted in legislation. So following those from the ARC of the U.S. and the ARC of PA can even give you more education to have those detailed conversations with local legislators. And then I think overall, just continuing to promote that education. So our webinars offer a variety of topics. And going out to resource fairs, collaborating with other agencies in the area. All of these are ways that you can gain information and become the most informed person yourself.
So many different ways that folks can get involved, and from just kind of following, like you said, maybe on social media or by email, and then figuring out what fits best for them if they want to get involved, in more meaningful or in direct ways, I suppose.
Yeah.
And you kind of nailed it, because my last question was, if you could leave the listeners with one thing, what would that one thing be? And that's hard to boil it all down, but you really nailed it in that answer. It really is about learning more and education. And I know that from this conversation, I can tell you that I have definitely learned, feel a lot more informed, but also in a position now to help hopefully others do likewise. So I very much appreciate your participating today, helping us to understand more about what you do, what the ARC does. Thank you so much for being with us. I wish you all the best going forward in the work that you're doing.
Great. Thank you so much for having me, John. I appreciate it.
You bet.
Stick around. We'll be right back to wrap things up. So what did we learn on this episode? Well, we learned that the ARC of Lehigh and Northampton counties is one of 600 ARC offices across the country. And as a result, they're able to be flexible to meet our local needs with the backing of a larger national organization. We also learned that they offer a number of supports and services, including advocacy, resource coordination, and training on a variety of topics. And lastly, we learned that if you are interested in getting involved or learning more about the ARC of Lehigh and Northampton counties, you can check out their website at www.arcoflehighnorthampton.org for more information. We'd like to thank our guest on this episode, Jessica McKenty-Nuttall, Director of Advocacy at the ARC of Lehigh and Northampton counties, for helping us to learn all about the ARC of Lehigh and Northampton counties. We'd like to thank all of you for listening to this podcast and invite you back for our next episode. Also, if you have any questions or feedback about the pod or have suggestions for future episodes, send me an email at jglees@magellanhealth.com. And if you enjoyed this episode, don't forget to hit that like button and subscribe to our channel for more Behavioral Health Matters content. Well, there's the music telling us it's time to go. I'm your host, John Lee, saying goodbye for now, but please remember, behavioral health matters.